So in this topic, I'm going to discuss about the imaging diagnosis, so such as X-rays and CT scan and MRI scan, and also some colonoscopy and sigmoidoscopy. How is going to do the all the investigation procedures. The first one is the diagnosis, the continuation of the last topic. So diagnostic imaging. So in the diagnostic imaging, so these diagnostic imaging are going to be process of producing the valuable pictures of the structures and also organs. So these imaging means because of these X-rays and also MRI scan and CT scan and fluoroscopy. So these are all going to give the clear information, the picture of the tissue and also structure and also organ. So that is the reasons. So these diagnostic procedures is important during the investigation procedures. And also it is used to detect the tumor and also other abnormalities to determine the extent of the disease and evaluate the effectiveness of the treatments. So these diagnosis procedures is not only identifying the abnormalities, it also helpful in during the to evaluate the effectiveness of the treatment. So in the during the treatment progressions, so we can understand with the effectiveness of the treatment. So if the treatment is effective for the disease or not. So we can understand with this imaging technology. So this imaging may also be used to when performing the biopsies and also surgical procedures. So some surgical procedures and also investigation procedures, that's biopsies, while taking the biopsies also. So these images are going to give the clear information. So how much of the the sample I have to take from the tissue for the analysis part, and also how much the surgical procedure, so how much the extent is have to do the surgical procedures. So with the diagnostic procedures such as the CT scan and MRI scan going to use while doing the surgical procedures. And also these diagnostic procedures have the three different type of the diagnostic procedures. So these are the one category is called as the transmission imaging. Another one is the reflection imaging and also emission imaging. So according to these three classifications, the diagnostic process are going to be different. So coming to the transmission of the imagings. So in the transmission of the imagings, such as the X-rays, CT scans, and also fluoroscopy, and these are going to be the radiological examinations whose image is produced by the transmissions. So the rays are going to be transmitted. So this X-ray rays are going to be transmitted. So it produces the images. So these transmission of the waves, the rays is going to give the images. So in this one, the high beam, so that's a beam of the high energy protons is produced and passed through the body structures being examined. For example, if anybody having any abnormality or any cancer or any tissue growth, extra growth. So this beam of the X-ray beams are going to be like high energy protons. So these are produced and passed through the what structure we are going to examine. And also these beams are passed pass very quickly through the lens-based tissues such as the secretions, blood and fat, and also leaving a darkened area of the X-ray film. So that means whatever the rays are going to be transmitted to the tissues, for example, the rays coming from here is going to pass through these structures, and also this image is going to produce on the film, that is the X-ray film. So on the dark the films. So there we are going to get the image, clear image. So the image will be, in case of the connective tissues such as the muscle and also ligament, tendon, cartilage, is going to be in the gray color, but the bone will be in the white color. So that's the reasons if you see the X-rays and CT scans, so the connective tissue structures and also muscles are going to be the gray color. And also the bone is going to be the white color. So these images is we can have to understand, so how much of extension, where they're having the locations, the lesion. So according to these images, we can identify the tumors and also the extension of the cancer levels. And also if you see the X-rays, so these X-rays are main important in case of the bone tumors. So in the bone tumors, these X-rays are going to be the clear informations. So what is the extent of the bone and also how much the size of the tumor, so we can understand the bone scan, like a bone tumors. So CT scan is going to be helpful in case of if you want to know the tumor shape and size and locations. So even though the blood vessels that feed to the tumors, so even though if you have the involvement of the blood vessels also, so we are going to identify in the CT scan. So it cannot detect in the X-rays, but the soft tissue structures are going to be, we can identify in the CT scan. And also another is the transmission, like a diagnostic procedure is a bone scan. So this bone scan is done to reveal the problems with the bone metabolisms. So bone metabolisms, if any like abnormality in the metabolism, especially the metabolic disorders of the bones, so we can identify with the bone scan. And also the lymphangiogram. So this one is going to be, so is going to study can detect the cancer cells or abnormalities in the lymphatic systems. So if anything in the lymphatic systems, so we can get the information with the lymphangiogram. And also next one is another type of the transmission diagnostic procedure is the mammogram. So this mammogram is very, very important to detect the any like a cancers or breast cancers, especially in the females. So we are going to detect the cancer, breast cancers with the mammograms. So these are all the diagnostic procedures to in the category of the transmission of the rays. So next one is going to be reflecting image. So reflection of the image. So these are going to be especially the ultrasound. So the rays, the waves are going to be reflecting. So the reflection of image refers to the type of imaging produced by sending the high frequency sounds to the body part or organ being studied. So if you want to study about any organs in our stomach or in the chest or anywhere, so we have to send the sound waves. So that is the ultrasound waves. So this is a high frequency sounds. So these sound waves are going to use the clear like image of our internal organs. So these ultrasounds are used to view the internal organs as they function and also assess the blood flow through the various vessels. So we can understand about the structure and also shape and size and also function of the internal organs with the ultrasound scan. So these scans are going to be examine many parts of our body structures, such as in the abdomen, breast, female pelvis, prostate, scrotum, and thyroid, parathyroid, and vascular system. So if any abnormality in these internal organs, so this ultrasound scans are going to detect the abnormality, size and shape and function. So with this reports, so we are going to detect the cancer cells and also if we respond according to the problem, so we can prevent the serious complications. And also if you see this ultrasound scanning also, we are going to do it during the pregnancy time to identify the fetal movements and also fetal growth, any abnormality in the fetus development, we are going to check through this ultrasound scanning. So this is also important during the exact diagnosis of the cancer. So next one is another technology, the emission imaging. So emission imaging is, so they're going to be the magnetic rays are going to be the emission to the body. So these are going to be like MRI, magnetic resonance imaging. So it's used instead of CT scan in situation where organs or soft tissue are being studied. So sometimes we cannot identify some problems and also, so we cannot detect the abnormalities in the CT scan. So which are not detected in the CT scan. So we are going to use the MRI scan. So these MRI scan are going to give the clear information about the soft tissue involvement. So how much of the extent of the tumors and also which layer is and also which tissues involving surrounding to the tumor also we are going to identify in case of the MRI scanning.